I'm located in Southeast Louisiana, about 100 miles south of New Orleans. It's a rural location. So we have barriers as far as access, transportation. We have a critical access hospital that is an 18-bed facility serving about 20,000 folks. We have unfortunately been an unhealthy state for a number of years. Louisiana historically has been ranked 48th, 49th, and 50th because of the increased comorbid conditions, starting number one with obesity and elevated BMI, hypertension, diabetes. We had a lot of patients that I think could have benefited from the monoclonal antibodies and missed that opportunity. We lost a lot of folks. Access is a big issue, but the bigger issue to me was education and informing the public. When we test people with COVID, we tell them about the criteria for eligibility. It's advertised in the waiting areas, it's advertised in the exam rooms. We did a very aggressive public service announcement campaign dealing with the local radio stations, the local cable access TVs, the local church leaders, and the local elected officials. And we listed very clearly, if you have these symptoms or comorbid conditions, you're eligible for it. The community looks to us as FQHCs to respond for particularly with the social determinants of health. So when I tell all my providers when we're recruiting them, when someone presents themselves to us, it's not a matter if we're going to treat them, but how are we going to help them navigate the medical system? So you almost have to have a bit of a social work persona to do the type of work that we do. Trust isn't earned overnight. We've been in our community for 47 years. The most effective thing is word of mouth and personal testimonials. You know, we have a process here in some of the churches where people stand up and give testimonials. Having those and capturing those on YouTube and then putting it out there has been a very powerful tool that we've used, word of mouth. With the monoclonal antibodies, we have this great treatment available, and the patients that I've sent, it's just been tremendous. Some of the testimonials that I've received in text and follow-up, it's like night and day. Within 24 hours, they are, I've had someone say they felt like they could go run a marathon. We go through a lot of things in medicine, and one of the worst feelings is when you have to walk in there and you don't have anything in your toolbox, sort of like Dorothy in The Wizard of Oz when she tells the wizard, I don't think there's anything in that bag for me. It's a great feeling when you have something in a bag to give someone. But you know that expression about help is on the way? Help is already here. It's not on the way, it's here and it exists. And shame on us if we don't take advantage of this gift. It's a gift.